Good afternoon. Thank you so much for taking the time to learn more about the VELscope and hopefully the benefits as we talk about for your patients. One of the things that we also want to talk about that we will share with you is that we truly believe offering the best care possible to your patients ends up being the best thing for your practice. Now, most people are aware or who are familiar with VELscope connect us with oral cancer screening, and that's absolutely, if you will, what we're proud of in terms of that connection. But VELscope is about more than just oral cancer screening. It's about oral assessment. And hopefully in that assessment process, we're finding precancerous lesions that help us to more effectively manage and potentially, as we have phenomenal examples of, to save lives. But starting off first when it comes to oral cancer, one of the things that I think is really important to understand is that by becoming a member of the VELscope family, you become an ambassador. And you have to become an ambassador because it's critical to share with your patients how important them coming into your practice every year or twice a year is, because one of the things that you do is to perform a thorough oral health examination. When we talk about oral cancer, I guarantee you most of your patients are not cognizant of all the numbers and the causes. It's quite frequent. We have customers who say that, clinicians who say that, when I introduce this to patients, oh, I don't smoke, I don't drink. So the perception is that it really doesn't impact them. I guess first and foremost, it's important to understand oral cancer is a cancer that's rising in the numbers. Depending on the year, it's anywhere between 9 and 12 in terms of its ranking in terms of cancers. And one of the things that, I suggest, have a question, or have a Q&A with your patients. Ask them, Mrs. Smith, what do you think are some of the top 10 cancers? And you'll hear regularly, breast cancer, colon, cervical, prostate, skin, lung, which is very common. I think that's what most people would say. But the reality is that I would say, and I feel very confident in the statement, 99% of your patients would never put oral cancer in that top 10 or top 15 category. And so from that, one of the things that I think is important to understand is that we have to put it into context. So we look at and compare it to cervical cancer, which most women will say is the top 10 cancer. And if you notice, there's actually 4 times as many oral cancers than cervical cancer. And what is it that women get every year? They get a pap smear every 3 years, depending on the insurance and your age. But pap smears are done on a regular basis. At one time, cervical cancer was the leading cause of death among women 50 years ago, and now it's I think in the mid-20s in terms of its ranking. So what this says is how important screening can be in terms of reducing deaths from a cancer that can be easily treated when identified early. And we hope that's the impact that we can have with, obviously, more thorough oral health examinations. One of the things that I think is really important, if we make that connection between cervical cancer and oral cancer, the majority of cervical cancers are caused by a virus, the human papilloma virus, specifically the strands 16 and 18. That same virus is now and I'm going to stress, the leading cause of oral cancer. So again, when you introduce these patients, a lot of times they don't think they're candidates because it's a smoker's disease, or it's elderly disease, or it's a heavy drinker's disease. No. Now, Mrs. Smith, yes, 15, 20 years ago, smoking was the predominant cause of oral cancer, but now, unfortunately, it's a viral disease that anyone can catch. Anyone can, unfortunately, be susceptible to this virus, which causes changes. And this is just reference to a study that was done where when they biopsy patients with oral cancer, 6% of those patients had the virus present in the biopsy. So study after study is now saying that, again, oral cancer is a viral disease. Not to say that smoking is not obviously a leading factor, not to say that poor diet doesn't play or heavy drinking, but it's important to say that 25-year-old healthy individual who works out readily is at risk per World Health Organization as much as a 60-year-old smoker. So think about that context and how important it is to do a thorough health exam. So if we look at oral cancer, unfortunately, it's still caught at a late stage. the majority of oral cancers are identified as stage 2 and greater, which means our survival rate's still a little better than 50%. Because like any cancer, the earlier we find it, the greater our survival rate. The challenge for our clinicians is that it's really hard to find these changes below the surface. And obviously that's where hopefully VELscope comes into play. If we can find them in a precancerous or dysplastic phase, we can remove it and avoid that from becoming cancer. So how does this technology work? It's very simple. We're using a safe blue light. It penetrates through the epithelium, and what we're doing is exciting predominantly collagen in the basal membrane. So we're taking our VELscope, turning it on, again, blue light, not like a curing light, you hear a little fan, but when you look through it, you see green. So green is normal. When we see something abnormal, specifically because of breakdown of the collagen in the basal membrane, it can no longer fluoresce. It can't respond. So instead of seeing green, we see dark or black. It's really that simple, and it's instantaneous. As soon as you present this light to the oral cavity, you'll see a response, whether it's green or abnormal. Abnormal doesn't mean cancer. Abnormal means further investigation. Just like if you see a red spot in the oral cavity, it doesn't mean it's cancer. It means investigate what's the cause, what could be sort of the issues. And we go through that process in terms of differentiation. So just to give you some pictures, we can see a little squiggly line here, nothing that maybe stands out as being of concern. But now in the VELscope, we definitely need to be concerned. This is unilateral or regular shape, persists for 2 weeks. We're going to talk about some additional techniques that we use to assess, is this really something that could be dysplastic or cancerous, was not resolving, and upon biopsy comes back as CIS, which is fantastic. So we caught this at a stage before it became full-blown squamous cell, which means we avoided radiation, chemotherapy, and obviously survival rates significantly higher. This patient was referred for the polyp, and they got the polyp for the polyp. They may not have found the dysplasia and CIS located adjacent to it. If you notice, the polyp was actually green, which was confirmed as benign. So these leukoplakias we see all the time. We tend to observe them because most of the time they're benign. Problem is when they really change is sometimes when it's too late. We can clearly see under VELscope dark area that indicates a abnormality, and upon biopsy, this comes back as severe dysplasia, which is fantastic. So we're not going to lose half our tongue. And having been in surgeries where people have lost half their tongue, which is horrific, we're avoiding that, and that's one of the key benefits. So it isn't just saving lives; it's the morbidity associated with the surgeries that are actually some of the most invasive, life-altering procedures that you can have done. The great news is most of these abnormalities that we identify are going to be benign. So hyperkeratosis, linear lichen planus will be green or light green in color. That tells us it's benign. Now I stress it doesn't mean we ignore it. We're always going to figure out, is it a sharp cusp? Is it an allergy? Is it a malocclusional issue? And obviously, if it's not resolving, it's okay to refer, but we're referring with a strong sense that it's benign. And that's the daily power that this technology provides you. So we see a red spot, right? Let's say it's from a denture. We remove a denture, we see a red spot. We assume it's a denture sore, but how do we really know it is? And one of the things that we want to do is we don't want to assume anymore. We want to feel pretty confident that something that's abnormal is of concern or not. And that's all we're doing. We can only say concern because concern becomes confirmed upon biopsy, right? Or a further assessment. But one of the things that you do with a VELscope is we blanch it. So a great benefit for us is hemoglobin absorbs this wavelength. And so from that, inflammation trauma will actually show up as grayish or maroonish in color. And once you get familiar with sort of that color, you'll notice right away. But one of the techniques we want to process every time we see something abnormal is take your Explorer, back of your mirror, and gently rub across it. And if you see it turn green, as the hygienist is doing here,
there we go. Perfect.
We're moving the blood out of the epithelium and seeing a nice healthy basal membrane that tells us this is a denture sore, right? If this stayed dark when we rub across it, that definitely increases our concern this could be dysplastic or cancerous, and you're going to obviously treat that appropriately. So one of the questions that always comes up is this going to increase my liability? Because I'm probably missing things under white light, but now if I miss something under this better light, am I more liable? And the first thing to understand is if you look through the device, you turn it on and look through, that's key. Turn it on and look through it. You aren't going to miss anything. you will see abnormalities that you may not see under white light. This increases your sensitivity of over 60%, which means, again, you look through it, you're going to see it. But what it also means is that it's really important. This is not diagnostic. So this is just part per FDA of your white light examination. So, people have different overhead lights, right? Different strengths of overhead. Some of you may wear loupes. Some may not. A person who wears loupes is not more liable than a person who does not wear loupes. And it's the same concept. By using a VELscope, you're not more liable. If anything, this should reduce your liability because we're going to identify things that you may miss under a white light exam. But I would stress, the frequency of liability, unfortunately, or lawsuits associated with oral cancer is only increasing. It's the number 3 leading cause of malpractice, with the average payout being the number 1 when it comes to malpractice and dentistry of over $1.2 million. So just to stress that, the studies show a white light examination is not effective in identifying oral mucosal abnormalities in a precancerous state. And that's where hopefully VELscope comes into play. So I think this picture sort of sums it up. So this patient was referred to NYU's oral medicine department. And when the oral medicine practitioner at NYU pulled out his VELscope, Ross Kerr, you may know, not too far from you folks. But from that, this lesion ended up being obviously dark. Upon biopsy, it was confirmed as stage 1 squamous cell carcinoma. Now, his context was, probably the doctor was so focused on lip, maybe just didn't continue doing a thorough health exam. But if this wasn't here, would he have seen the slightly raised area? And so if he missed this, he's more liable potentially, but obviously you shine this, you look through it, you're not missing this. And this is how so much more beneficial this is in terms of identifying lesions that you may miss under a white light exam. So again, this Cervical, right, finding dysplasia, we're not trying to find cancer. And last picture, because I think this really says it all, the challenge that clinicians have when it comes to identifying abnormalities. So this was sent to us by a world-renowned oral pathologist who was pretty amazed about what you see under VELscope versus what you can see under white light. This is unilateral regular persists for 2 weeks. When we rub across it, it stays dark. That says concern, and upon biopsy, it's already carcinoma. So again, just reinforcing that it's almost impossible to find these early stage cancers with a normal white light examination that hopefully VELscope will assist in finding. So one of the biggest challenges we had when we first came out with VELscope many years ago was you would see this under VELscope, you send it to an oral surgeon who didn't have a VELscope. It's like, I don't see anything, I don't feel comfortable taking a biopsy. And then you're in this quandary, what do we do? And so over the years, we've developed processes to take pictures. And our latest iteration is using a special adapter for an iPod. So this is an iPod, and the adapter, once you put the iPod in, then allows you to attach the iPod to the back of the VELscope, real simply horizontally or vertically. There's an app you download, and that app then allows us to take a picture, store that picture in a HIPAA compliant manner, and then you can actually email that picture as well to a specialist if so desired. Actually, and it gives you the ability to provide specifics associated not with the patient itself, but the lesion. So size, color, location, induration, what have you, that provides more information to then obviously hopefully provide a much more, I guess, definitive assessment as to what it could be. So this is just an example. You can see here where the clinician is taking a picture, both under white light and under VELscope, for that when it's referred, we have the ability to obviously have that comparative assessment for the referral. So, one of the questions that comes up frequently, well, what about false? Actually, it used to come up frequently, it no longer is. And that's false positives. And this usually comes more for specialists, oral surgeons, and some of which are legitimate, especially if you're just referring anything that's abnormal without making an appropriate assessment, unilateral regular shapes just for 2 weeks, Q&A with the patient. But the reality is, if you follow those protocols and incorporate with the blanching technique, you're going to have a pretty good sense if this is something of concern. And the reality is, most of the things you actually see with VELscope actually are confirmed are benign. as opposed to sometimes of concern that you're not really sure, and therefore obviously you're going to refer. I'm not saying referral is bad, but having that information provides not only, I guess, a higher level of confidence for you, but hopefully a better sense of comfort for the patient as well. Tons of clinical evidence. So if you go to our website, you'll see over 30 studies on VELscope. And I can say this with confidence, there's probably more studies on VELscope than the restorative product do every day. And if you notice, these are peer-reviewed, well-respected medical journals like JAMA, Head and Neck, Oral Oncology, Clinical Cancer Research that really demonstrate the efficacy of the technology. So there is a code for reimbursement, D0431. In most areas, we're probably getting about 20-25% coverage. Medical plans like medical dental plans like Guardian, Humana, United, some Aetna plans tend to cover this. The Deltas of the world, unfortunately, there's no incentive for them, as opposed to United. If you can identify this as a precancerous lesion, you're going to end up saving a lot of money on the medical side. Delta has no care, in all sincerity. So we find they're a little more, I guess, resistant when it comes to coverage. But the great news is coverage isn't important. It's about first your price, and then secondly, the value. Actually, the first thing is the value, being able to present it effectively to the patient, and then your price. If you charge $100, you're probably going to get a lot of acceptance. We did a survey of users. We had over average of 70% acceptance when the price was around $25, which means for most practices, you see the majority of patients saying yes to the technology. So we understand this is not about money. Obviously, it's about better health. But again, our premise is better health leads to better practice, more profits. And from that, there is a cost, obviously, with the VELscope. And so our normal DSO discount pricing is $19.95. Obviously, there's a tax benefit associated with that, as it is considered equipment. Looking at $25 and a conservative number of 3 versus our average of 7 patients accepting the technology, this should pay for itself in a little over a month. And obviously, if we're getting more than 3 or charging more than $25, this is going to pay for itself in less than a month. So, when you think about all the technology that you've incorporated into your practice, there's not a lot that I would say allows you to get an ROI in this short period of time, not to mention all the other clinical benefits that you may have and revenue benefits. One of the things that I like to share is, again, this is about oral assessment. This isn't about oral cancer, and it's critical. So you're going to see abnormalities in the mouth regularly, and that should initiate conversation with the patient. So one of the things you're going to see very frequently is orange or red, especially on the dorsal surface of the tongue. And so stealing this from a practice that was getting great acceptance of their mechanical toothbrushes, what we're doing is taking a picture, showing the patient, Ms. Smith, you see this red on your tongue. This is called porphyrin, or in layman's terms, bacteria poop. The problem is with your manual toothbrush, it's just hard to get in the nooks and crannies. And obviously, if this bacteria waste is on your tongue, then it's also in your gums, which is why we really recommend you need to have this Oral-B or Sonicare to get this crud, if you will, out of your mouth. And so using that visual is so effective. And I have to say, in all fairness, using that visual with the word poop is critical. You can achieve significant increase in terms of acceptance for your mechanical toothbrushes. Lastly, and this goes to what I started off with, is that you have a great opportunity to be ambassadors, sharing this with every patient, how important this is for them to have. Obviously, the increase of rates of oral cancer, the connection between oral cancer and HPV. One of the things I would highly recommend is doing a program with a clinic, a hospital. This is an example of a doctor. He set up basically called the hospital down the street and said, hey, I want to set up a screening event. We're concerned about the increased rates of oral cancer. And this is actually a poster that the hospital put out throughout the hospital that obviously was for everyone. And what this doctor said, it wasn't about the new patients that he got from screening. It was actually about the referrals that he started getting from physicians that were actually probably just as ignorant about oral cancer as the patients were. So it's a great way to, again, increase awareness and then as well provide an opportunity to hopefully grow your practice at the same time. So, one of the things that we just want to share is we've been around for many, many years. We're still rated as the #1 screening technology out there year after year after year. It's not only because of clinical support that no one has, the photo documentation capabilities, and the support as well behind the scenes that we provide you when it comes to training, online training. We actually have a referral service. So if you have a concern, not really sure what to do, you can provide us pictures and information of the patient. We actually refer that to world-renowned oral pathologists to provide guidance and support. And that is free for our DSO partners. And then, with that, based on the numerous 20,000 plus offices that have this technology, I think we have a phenomenal track record of not only something that worked for the practice, but phenomenal track record of examples of literally how we've saved lives. So with that, if you have any questions, concerns, issues, please do not hesitate to give us a call. Again, go to our website, VELscope.com as well, where you can get additional information. And from that, we look forward to hearing from you soon. And thank you for listening to our presentation today. Take care.